All right, we're going to go ahead and get started with our fourth and final presentation, the one that stands between barbecue and beer, I believe, outside. So our next speaker is Dr. David Brown. Dr. David N. Brown is a licensed marital and family therapist in the state of Iowa and a clinical fellow of the American Association for Marriage and Family Therapy. He currently serves as a behavioral state specialist for Iowa State University Extension and Outreach. His key program and grant emphasis are on farm stress management, mental health outreach, mental health literacy, and suicide prevention. Join me in welcoming Dr. David Brown.
Thanks very much. Can you hear me? All right, there we go. I've got some handouts I'm going to have passed out. And if your organization would like some more, let me know. These were handouts that we produced, funded by the USDA in collaboration with the Iowa Department of Agriculture and Land Stewardship. So if your organization would like more, please let me know. But we're going to talk a little bit about resiliency and the work site. And I was talking to the previous presenter, and I'm going to use some of his examples in a very positive way as we get through this, because I really liked his presentation. Because we're going to talk a little bit about employee burnout and some ways to manage that, and he has some really good examples of how to do that. So I really appreciated his presentation. Okay, again, we're going to talk about how to be more resilient in the face of adversity. And so we're going to also talk about some resources and activities that can help you and help those also in your work site. And what I want you to think about resiliency, and I love this way, is basically filling up your own cup so that you can overflow the lives of others. And basically what I'm going to say is a lot of times we have to take care of ourselves first before we take care of others. Can you still hear me? Okay, good. I always have to put a disclaimer on my programs because we often will talk about some difficult things in some of the programs that I provide. So we're going to talk about this may be an uncomfortable topic for some of you. It may, because we know many of you have been deeply impacted by maybe the recent pandemic, some type of adversity related to agriculture, and other things. Also, we talk about here, sometimes we have a lot of discussion. We want to keep that confidential. So what we talk about here stays here, okay? Respect the feelings and views of all who participate, and again, take care of yourself during this program. We want to make sure that you need to go get a cup of coffee, use the restroom, you do that. You take care of yourself during this program. Okay, guess what? I think we've heard a lot about this today. The two plenary sessions this morning were really, really interesting. It's been a really few interesting years, don't you think? Raise your hand if you think it's been a few interesting years. Okay. What we know is that rates of anxiety and depression were 3 times higher during the COVID pandemic than they were in 2019. 3 times higher, that's self-report. Now what's interesting is that these rates have remained elevated for an extraordinary prolonged period of time. In fact, we're still living with rates currently at almost 3 times the level that was in 2019. Now, from what I saw in the plenary this morning, I don't think that's going to change. Do you? Everything that's going on in the world right now, I don't think those rates are going to go down. And so we have to talk about resiliency and how we're going to manage that. But you know, there's all sorts of ways that individuals can deal with anxiety and depression, right? And I'm going to kind of show you some ways that people are dealing with it now. Guess what? Liquor sales are up. In fact, they're skyrocketing. You know, and you know, I think when I went through the pandemic, I probably did some tasting of whiskey and scotch during that time. Liquor sales have skyrocketed. Now this is in Iowa, but I can tell you that the national statistics are very much the same, okay? The rates of liquor sales are skyrocketing. Unfortunately, also what is happening, the rates of overdose are also happening. And this is primarily related to the synthetic opioid called fentanyl. Now, if you know what fentanyl is, it's basically a synthetic opioid that's 100 times more powerful than morphine and 50 times more powerful than heroin. And so what's happening, that is getting into some of the illicit substance chains. And basically with that powerful of a drug, it's very easy to overdose on any type of opioid that involves fentanyl. So drug-involved overdoses are skyrocketing as well. The other thing we've noticed, guess what? The casinos are doing well. You know, average annual revenue growth was about 1.4% per year. Once the casino opened during pandemic, they started a growth rate of 8.1%. People are gambling and drinking more. Guess what? That's how we're trying to manage some of our anxiety and depression that we're seeing. Now, what we're going to do at the end of this, we're going to hopefully talk about maybe a little bit better ways to maybe focus in our resilience efforts rather than drinking or going to the casinos. Okay, and I want you to think about that. If this is our new normal, what are the implications for ourselves in the work site? Very high levels of anxiety and depression that we may be all experiencing. I just want to think about that for a minute. What is that? What is the implications for ourselves in the workplace? Okay. What I'm going to do now, and what I do in a lot of my presentations, I talk a little bit about the signs of stress, because not only do I want you to know what the signs of stress look like for you, but I want you to know what it may look like for your employees for a couple reasons. Number one, if you're the manager, then you may be seeing some of these signs in some of your employees. You may have to involve yourself or direct that person maybe to an EAP or whatever, but you may have to get involved. So we want to make sure that you know and maybe be able to see some of these maybe factors in some of your employees as well. Now, fortunately, most of these signs that I'm going to show you are short term. That means, you know, we've had a really, really bad day and, you know, get a good night's sleep and they go away the next day. But there are also sometimes maybe more signs of chronic stress that really need to be addressed. And so we're going to talk about that as well. Okay, again, we're going to talk about acute stress response. We're going to talk about chronic stress response. We're going to talk about burnout and compassion fatigue. And yeah, compassion fatigue can impact the agricultural community in a variety of different ways, and we'll talk a little bit more about that. Okay, these are those things that we can typically call acute stress reactions. This is what I call normal stress. You know, you have a really, really bad day, and boy, or maybe a couple of really bad days, and it's just been rough. But then you get a good night's sleep, and then things are okay. I know when I'm really stressed, I get grumpy. I get really irritable. Now, my wife, on the other hand, she gets migraine headaches. So I can tell very clearly when she's under stress, and obviously she can tell when I'm under stress, because I get grumpy. How many of you get grumpy when you're stressed? Okay, how many of you get migraine headaches or anything like that? Okay, so this is pretty normal response to stress that we may probably experience, you know, very often during our work career. But we also know that our body is only really developed or suited to manage stress in a short-term basis. Our body is really lousy at managing stress on a long-term basis. And so what happens is after the stress continues, we start to see some of these things. We start to see elevated blood pressure, we start to see fatigue, helplessness, and we start to see a greater amount of sleep and appetite disturbance. We're also become more forgetful. And then we have some gastrointestinal issues that start impacting our body when stress becomes more chronic. And finally, all of that causes so much wear and tear on the body. If the stress continues, we start seeing other things. We start to see heart attack, stroke, you know, that elevated blood pressure over a long period of time, you know, that can lead to heart attacks, strokes. We can lead to weight gain, diabetes, deterioration of the immune system, which was really, really bad when COVID was really prevalent. That was not a good thing to have during the pandemic. And we also start to see depression, anxiety, substance use, and potentially suicide. One statistic I didn't put up on the chart was the rate of suicide nationally. Now, what's really interesting, there was huge predictions of a death by suicide spike during the pandemic. And it didn't happen. What actually the level of suicide, deaths by suicide in the United States actually went down during the pandemic. And it was kind of, could have been a variety of factors. It could have been, we're all in this together because we were all impacted by COVID. It could have been just, we were home more, bound by our family and friends. So it actually, rate of suicide went down, except in Iowa when it went up. Except in Iowa. Okay, I'm going to move on to burnout. Burnout is very, very similar to the chronic stress conditions that I mentioned. Unfortunately, individuals with burnout do not see an end to the level of stress that they're under, and they don't see how anything's going to be changed. And they have this dread of going to work if you're burned out. They just dread going to work because they don't see an end, they don't see how it's going to be fixed. And it's related to where you work. It's site-specific, burnout is. It's basically related to work conditions that are adverse, including long hours, high demands, and a very high workload that continue on and on. Again, it also shows many signs of chronic stress that I reviewed, but also signs of exhaustion, cynicism, and reduced personal accomplishment. You also see a lot of job dissatisfaction, absenteeism, people not showing up for work, or presenteeism. Now, what presenteeism is basically, you're at work, but you're really not. Your body may be there, but the rest of you isn't. And that's what we call presenteeism. And so you'll see that as a part of the burnout. It's gradual, so it kind of sneaks up on you. Those work hours just kind of build and build over the time you get to burnout. Okay, now burnout in farming. There's been some research done on what are the factors involved in burnout in our farmers. And what they found is this list, is lack of time, uncontrollable events, which is certainly a part of farming, conflict with associate or family members. We know that there's a lot of farms that are multi-generational, and that can be a lot of conflict there, especially in succession planning, things like that. Uncertainty about future financial markets. Right now, things are looking good, but we never know, right? If you think about what we heard in the second plenary, the last plenary we heard today, wow, things may change down the road. So I would be more worried about the financial markets right now. Agricultural legislation, physical isolation, financial worry, and then again, that succession planning, multi-generation, really can add to the level of stress and burnout to farmers. So that's what we know. What needs to happen? Both organizational and individual change needs to happen to manage burnout in employees. And the companies and the individuals all need to focus on improving self-care, social support, and purpose. Now, that self-care could be a lot of different things. It could be, managing, making sure individuals take their time off. I know I'm salaried, so I can put as many hours that I can want to. But I know my boss gets on me a lot, making sure I'm not working weekends, things like that. So, this is the time that maybe you manage your staff are not working not enough, but maybe they're working too much. And so maybe managing the staff time to make sure they're not putting in too much time. Self-care, making sure they're not working on weekends, make sure they're taking their time off. All those things are involved in making sure that you and your employees have an opportunity to maintain self-care and manage that work-life balance. Social support. I really like some of the things you talked about, your employees going out on like a canoe trip or something like that. Things like that build social support among colleagues and build that colleague network. Those are great things to do to have at a work site. I know in my work site they were doing some things about book groups, book reading groups, and I don't really get into that, but some have really like to do that. But they're trying to do things to encourage that social system at work to ensure that people are not isolating themselves and things like that. So things like that to build social support in the work system really help to manage burnout as well. And then purpose, making sure the individuals have opportunities for professional development, cross-training, I think you mentioned. Also finding their right niche. So they feel like they have a purpose at work. All those things can help manage the burnout system. Because what do we know? If those don't get fixed, what are the employees going to do? They're going to find someplace else to work. Because if you cannot, if the employer and the employee cannot come to an understanding with the work market we have currently, they're going to find someplace else to go that knows that they're going to do a better job of taking care of them. Because there are options out there. Now, how many of you heard about the Great Resignation? We've had a huge, since the pandemic, the Great Resignation has occurred. Now, that's a whole bunch of factors that are involved with it. Part of it's low pay. Part of the boomers out there have decided, well, I don't need to do this anymore. I'm just going to retire. Or, if they're living in a toxic they're working for a toxic employer, they're going to go someplace else. We also know that childcare has impacted the workforce. The individuals have decided, I'm just going to stay home with my children. I can't find a childcare. So there's a whole variety of different factors that are involved in the Great Resignation. But probably the key one is individuals are looking for a better place to work. And so if some of this is not managed in the work environment, people will find someplace else to work. And they'll make that decision and go. And losing employees all the time is costly and inefficient for any business that's out there. Okay. Compassion fatigue. Now, I know probably you're wondering how is compassion fatigue related to agriculture? But this is Charles Figley. He's probably the foremost expert on compassion fatigue. He says that compassion fatigue is a state experienced by those helping people or animals in distress and can create a secondary traumatic stress for the helper. So any of those individuals involved in caretaking individuals, veterinarians, obviously in the swine business, you're caretaking a lot of animals as well. So this is a big part of where that comes in, is if animals are distressed. So again, and where this is typically shown up in the livestock arena is, for example, during the swine disease epidemic, when you had to do some depopulation. It's really that there was when they had one of the swine diseases over in England a number of years back, when they had to do a lot of population, quite a few of the farmers came up with not only compassion fatigue, but post-traumatic stress disorder. So we know that compassion fatigue can be very prone when we're depopulating animals. And we had to do a lot of that right around COVID, right? Okay. Now we know that we had to do a lot of that with the avian flu outbreak. And so I was really nervous about compassion fatigue and PTSD as we were depopulating a lot of the poultry populations in the north central region. But again, it involves being traumatized while trying to help or just doing your job. Sometimes we have to depopulate animals, euthanize the animals. That's not a fun thing to do. Or the person just really and deeply cares. That's a factor in compassion fatigue as well. Again, this is often more associated with helping professionals, mental health professionals, healthcare professionals, individuals like that, but it also can impact the swine industry and other industries such as the poultry industry as well. Onset is really, really rapid, but actually compassion fatigue is fairly easily treated, and we're going to talk about that in just a minute. I post the slide up simply because I want you to look at the items highlighted in red: withdrawal, hypervigilance, sleep problems, avoidance, absenteeism, things like that. Those are the exact symptoms that you would see with an individual with post-traumatic stress disorder. There's a lot of different similarities between compassion fatigue and post-traumatic stress disorder. And so I just wanted to highlight that. So if you're involved in depopulating animals or anything like that, that's something you need to be aware of, and you have to look for these signs and symptoms and make sure that if they've occurred for a long period of time, then you probably need to look at getting some type of professional help for that individual or yourself. Okay, so what are we going to do? We're going to fill our cup. And one of the key things about compassion fatigue can be alleviated fairly easily by, guess what? Excellent self-care. In fact, excellent self-care is probably the foremost thing you can do to not only manage chronic stress, but also managing burnout. Excellent self-care. I'm going to tell you what that means. I was at a national psychotherapy conference a number of months ago. The best of the best psychotherapists in the nation were at this conference, talking about kind of the new things going on in psychotherapy. And one of the keynote speakers said, I'm going to apologize to you because I'm going to talk about self-care. And what I know is the two best things you can do for self-care is, guess what? Get a good night's sleep and exercise. And if you get anything out of this program, is that if you exercise more and better sleep, you're going to be a better person and do a much better job taking care of yourself. If you get anything out of my program, figure out how to get a better good night's sleep and exercise more. And how many times have you heard that from your physician when you go to get your physicals and things like that? Getting a good night's sleep and making sure you get at least 30 minutes of exercise per day is an amazing way to manage your self-care. Now, there's some other things you can do as well. Obviously, you need to eat healthy. Spiritual practice, prayer, solitude are all good things to do to help manage our stress response. Meditation, mindfulness, journaling, deep breathing are all, again, other items that were very helpful in managing stress responses and that stress response system in our body. Now, why I put down intentional planning? Now, why I put that down is because many of these self-care practices you have to plan to do. And what I mean by that is that I actually put in my calendar times to pray. If I don't put it in my calendar, it doesn't happen. So if you're going to go exercise or whatever, make sure you intentionally plan to make sure you get it done. Again, for me, if it's not in my calendar, it typically doesn't happen. So you really have to be very planful and work some of that into your daily schedule. Okay, social support. You know, we talked about social support work and building out those colleague networks. That's all great too. But we can do the same in our own personal lives as well. You know, we can find individuals who you trust, who you can talk about. You know, it could be your spouse, family, friends, a trusted colleague. You know, find someone that you know and trust and have that conversation. Just be able to have an open conversation. I know in my area, I live in Boone, I know the healthiest thing the farmers do in my area is those coffee breaks in the morning, right? Coffee at the Casey's, or in Boone, it's the Dutch Oven Bakery. You got to go to the Dutch Oven. Any of you from Boone here? Got to go to the Dutch Oven Bakery. You know, a great place to have coffee, whatever, snacks. You know, those coffee groups are probably the healthiest thing most of the farmers do. Way to have that social support. Go on a date. Okay, I add this in almost every one of my presentations. I'm a marriage counselor, right? That's what I do. One of the things I've seen too often when I start meeting with couples, I ask, okay, when was your last date? And guess what I get? I get a blank stare. So I really recommend, and I got to ask this, if you have a partner, go on a date at least once a month. because you really have to nourish that most important relationship in your life. Go on a date. If you haven't had a date and recently, this would be a good time for you to go schedule one. Make sure it happens. Go on a date with your partner. Just social time. You know, like I mentioned those coffee groups. Anytime you can have a social time. I don't care if it's at church, at work, if it's at a Rotary Club or Kiwanis group, whatever. Make sure you build social time into your life as well. And then join a group. Kiwanis, Rotary, church group, civic group, I don't care. Join a group to have you additional social time. That's, again, a big part of our social resiliency to make sure that we have enough in our cup to actually help others as well. Purpose. Help others who in need. I've done a lot of training on work-life balance. And so one of the things I always talk about is not only helping yourself, but helping your fellow person. And some of that's by volunteering. And they look at me as like, okay, I'm already having problems with my work-life balance, but you're telling me to volunteer? I said, yeah, I am. Because all the positive feelings that we get from volunteering to help others balance our work life. So go ahead, and volunteering is a big part of our own network. It includes that social piece too. But I suggest volunteering. You know, it could be simple. I don't care what it is, but make sure, you know, volunteering, maybe even giving out some extra donations or things like that. Do some things you need to do to help someone else. It is a big part of having a purpose in your life beyond work. Move toward a goal. You know, it could be anything. You know, maybe saving money for a vacation. It could be, you know, if I'm really, really stressed, maybe I need to set up that physical with my primary care physician. You know, things aren't feeling good. I need to talk. If you want to set up a program with an EAP provider or, you know, mental health provider, maybe that's a good goal as well. But, you know, move towards a goal. I know my wife and I just turned 60. So guess what my wife and I are doing? Our goal is to retire and to retire well. And so we're starting to get things in order in our life so that we can retire. Me in maybe about 4 years, her in a couple years. So that's our goal, is to get everything in place for us to retire. So that is my goal. And then being more than your occupation, okay? Whatever your job is, we can be more than that, okay? We can be a school board member. We can be a church committee member. We can be on a Rotary Club. We can be at Kiwanis. We can do other things than our job. And again, that brings balance into our life and adds additional energy to our work life, if you can believe that. So we can be more than our life. Now, one thing I said about volunteering, I've done training for veterinarians. If you're going to volunteer, make sure it's something different than your job. So I've told the veterinarians, don't volunteer at an animal shelter. That kind of defeats the purpose of having a volunteer opportunity. It's got to be different from your job. Okay, embrace a positive attitude. We are really, really good at catastrophizing things. You know, one little thing goes wrong and my whole life is gone, right? We're really, really good at making things a lot worse than it really is. And so we have to keep things in perspective. Okay, maybe I had a bad day at work, you know, maybe I got in a little trouble with my boss, but tomorrow's another day and we can move on. We're not going to catastrophize our whole career just because we had one little thing at work go wrong. We can move past that, but we need to get a perspective on that. We need to accept change. Okay, a lot of change. We heard from plenary, a lot of change coming up. We have to accept change and know that it's coming and accept change as the norm. And finally, we need to be grateful. We need to be grateful for the things we have. We need to be grateful for things like our family, friends, where we live. We need to promote an attitude of gratefulness and thankfulness. And during COVID, our attitude was one of, at least where I worked, was one of grace. Is that we were going to give each other a little bit more of the benefit of the doubt because everybody was stressed. It was a really tough time for everyone else. And so we're going to give each other a little grace and gratitude. And I think that was a really good way for my work site and my work situation to help make living through COVID a little bit better, the time of extreme stress for just about everyone. Okay, just for discussion, I want you to think about some things, okay, during this week. And usually I do, this is kind of a group discussion, but this format really isn't set up for that very well. So what I'm going to do is I want you to think about this for a little bit, okay? What types of excellent self-care are you doing now? Is there something I could do more? Am I doing the right things? What types of excellent self-care maybe I can do a little bit better to improve my resiliency? Okay? If you're a manager, maybe what can you do a little bit more at work to help your employees become more resilient? I really like Max's examples, great examples, so I really appreciate that. Other things to think about. Think about your workplace in the last 2 years. What's changed? You know, we've had huge changes, you know, working from home, not working from home, this and that. What has changed? What is harder or what is easier in your work site? Again, we usually have these questions for discussion. What is harder? What's easier? What resilient strategy that I spoke about resonates most with you? What is something you can take, or what strategy that you maybe want to improve on or do? Again, what strategy do you think might be helpful? And then, how might you share some of these strategies in your work site? Better self-care, getting a better night's sleep, exercise, social network. How can you build on some of that at your work site to make it more resiliency focused for your employees? Because if you don't, they're going to go someplace else. Okay, I do always like to provide some resources at the end, just because these are things that if you have employees that may be stressed, or you may be dealing with maybe a burnout, or an employee dealing with compassion fatigue, whatever, we want to make sure that you have some resources. Suicide Prevention Lifeline, 1-800-273-TALK, 8255. I believe in July, it transfers to a 988. You just call it 988. It's answered actually in Iowa, but it has resources across the state. You can call 988 to get to the Suicide Prevention Lifeline. Pretty easy number to remember. Great resource. I always have to mention Iowa Concern Hotline. This is the hotline that's provided by Iowa State University Extension Outreach. Available 24 hours a day, 7 days a week. Connect with emotional support through trained stress counselors. You can also have access to our family finance counselors, and we actually have an attorney on staff if you need some legal education. I know they get really busy during the time of year when farmers are negotiating leases. Okay, that's a big topic of concern when they call in. Again, available 24 hours a day, 7 days a week. Project Recovery Iowa. In the handout that was passed out, there was a separate flyer, and in the flyer it said COVID Recovery Iowa. Well, the name has changed to Project Recovery Iowa, and this is basically a service available to anybody impacted by local disasters or COVID, which means just about everybody, right? You can access free, private, virtual counseling and any other resources through a grant through the Iowa Department of Human Services that Iowa State University Extension is a part of. I actually hired 2 licensed mental health professionals just to be able to answer calls and work with individuals who are struggling with COVID or local disasters. And so we can get hooked up with that free, confidential if you have individuals who are struggling or know struggling with any of the recent disasters or COVID still. We also have a Spanish line for individuals who are Spanish speaking. One of the staff that we hired is one of the Spanish speakers that is on that line. So 1-531-800-3687, it is staffed by Spanish speaking individuals. And finally, the USDA has provided a lot of information and resources and funded 4 regional farm and ranch stress assistance centers. The one in the North Central region is out of the University of Illinois, farmstress.org. You can find resources regarding farm stress for every state in the North Central region. And they also have national resources of the different farm and ranch stress assistance centers. Other mental health resources, Iowa Department of Iowa Mental Health and Disability Regions and Your Life Iowa will help you access mental health providers and potentially funding by going to that website. By going to the Iowa Mental Health Disability Regions, basically you can go in there and find a mental health provider in every county in Iowa. It's a great place to find resources. Okay, questions?
Before we open it up for questions, please join me in thanking our speaker, Dr. David Brown. I believe we've got about 4 to 5 minutes for questions, so if you have a question, raise your hand. I'll bring you the microphone, and we can get those questions answered. I guess I'll start again. So I actually was thinking in our industry, we're really predicated around toughness, and we're accustomed to death. How are some things that you can do that farm managers can do to make people more open to talk about those things or kind of back down from those feelings?
Good question. One of the quick ways to approach employees, basically you say, hey, I've noticed certain changes. Maybe you missed a few days of work, and I'm kind of concerned because number one, it's obviously impacting your work, but I'm also concerned about you. And I just want to know if you want to have a chance to talk. Because there's a really, a fine line between an individual suffering from for example, maybe a mental health disorder and maybe just not doing a very good job at their job, okay? Some of that is a little bit of both sometimes. And so, but you want to say, hey, I'm concerned, just want to check out if you need any resources or need assistance, let me know, because I have some resources available that might be able to help. If you want more information on how to deal with employees in situations like that, in the handout provided, we have 2 classes that we offer through Iowa State University Extension Outreach. One is called Mental Health First Aid. It's an all-day class. And another is called Question, Persuade, Refer, which is a very short program on suicide prevention that is 1 hour long. It's basically, mental health first aid is basically the gold standard on how to deal with individuals who may be struggling with a mental health issue or a substance use issue. It talks about how to approach, resources available, and how you can respond to individuals that may be struggling with that. And so we're offering that for anybody involved in agriculture, which would be you, at no cost. We're also doing a lot of private classes for organizations. We're doing basically 2 classes a year for our ISU vet students. We're going to be doing probably some classes for the Iowa Department of Animal Science for their students. So we're doing a lot of mental health first aid across the state, because for those type of situations, we provide it at no cost due to a grant from the USDA.
Awesome, thank you. Time for one more question if anybody has one. Otherwise, we will go ahead and dismiss. One thing, while you're thinking of a final question, we do have barbecue and beer outside, provided by AB Vista, Tech Mix, and Lynch, I believe. So please join us in the same area that we had lunch this morning, and please join us there. Otherwise, let's thank our speaker one more time. We'll go ahead and dismiss.